Hi, I'm Henry Acosta, and today in studio we have Chris Knauer. He graduated with honors along with getting a bachelor's degree in science. He's been working in the corporate world for 20 years now and has experience in finance and corporate advisory. He has become CEO of ASX listed companies in the past. Right now, he's the executive director of MediBio. MediBio is an Australian listed company developing a digital health platform. Today, we're here to talk about MediBio and its partnership with Mental Health Check-in and how their research and application is important and is taking great steps in making sure that people get to a healthier state of mind, especially those in the workplace. Hi, Chris. Can you tell us a little about yourself and how you became CEO of MediBio?
Yeah, sure. Look, MediBio is an ASX-listed company. We're developing what will be the first sort of FDA-approved diagnostics for depression and other key mental health disorders, as opposed to the traditional sort of psychiatric test where the psychiatrist asks the patients question and answers. Our test is based purely on your biology. I sort of became the CEO. My background is corporate. I've been CEO of ASX-listed companies before, and originally I was just an investor in the technology and the company, and basically took on the CEO role around about 18 months ago when I think it just became apparent that two psychiatrists running a listed company is probably a recipe for disaster in terms of commercializing the technology.
And can you tell us a little bit more about what MediBio does and what it provides?
Yeah, so what we provide is we're currently finishing our research with Johns Hopkins University in the US and also Ottawa University. What we can do is taking your overnight heart rate data, we've got a series of diagnostic algorithms, and from that heart rate data overnight, we can tell whether you've got depression, you've got anxiety disorder, you've got schizophrenia, or you're normal. Effectively, what we're doing is we're using the overnight heart rate data when there's no external influences to take a snapshot of the autonomic nervous system and pick up disruptions in the autonomic nervous system.
And can you tell us a little bit about www.mentalhealthcheckin.com and what it's about?
Yeah, love to. So mentalhealthcheckin.com is an initiative put together by Vital Conversations, who are the leading mental wellness group in Western Australia, and us, and also HBF Insurance, who've come on board as exclusive health partner. What mentalhealthcheckin.com lets you do is if you log on to that website, www.mentalhealthcheckin.com, you can register and you'll be sent basically a dual test, which is sort of traditional pen and paper stress test and also test to determine your resilience and sleep, and also MediBio's new stress test, which is an objective test based again on your overnight heart rate data. And then, about 3 weeks after taking these tests, you'll get a diagnostic report produced, which will basically tell you your sort of mental state and any key risks based on both the traditional psychiatric reports and also our new objective test based on your sort of overnight heart rate architecture. Mm-hmm. And it's a good opportunity for people just to see how they're travelling mentally. Stress is probably the largest precursor to the development of a mental health disorder. Mm-hmm. Harvard have done some work showing that they think 60 to 80% of all GP visits are a direct result of stress, and mm-hmm. stress leads to a number of other disorders as well as mental health as well. So, but if you take the check-in, you can just see how you're travelling and coping with stress.
And I see here that you guys have been researching and have been trying to develop this for over 15 years. Can you tell us how far you guys have gone with the research?
Yeah, look, I mean, we're right at the pointy end now. We've put out our first batch of clinical data where the results were great, sort of better than 80% diagnosing depression from non-depressed, which is certainly, it's better than the current gold standard. So, we're sort of getting to the point now where we hope to have FDA approval within 12 months. Mm-hmm. And really, we've been going at it sort of full steam ahead for about the last 18 months from when, the listed company got involved in the technology. Really, the sort of first 15 years research was just, collecting the data you need to get these machine learning algorithms to be able to differentiate between the different mental states.
And can you give us an assurance that the data that will be given to you guys, it will interpret the data accurately to what your mental or how your mental health is?
Oh, yeah, look, I mean, I suppose first thing is the current gold standard out there is not great, around about a 70% accordance between two psychiatrists, and at the sort of stress level and the self-report level, it's not as good. Generally, sort of, the accepted accuracy rate is about 60%. You look at our accuracy level, we're getting sort of better than 80%. Which is, again, a study done with Ottawa University, and then internal, validation studies and work we've done on our stress test. We're getting similar accuracy levels. I mean, unfortunately, this will never be a 100% test, in the same way that, the current, psychiatric test is, not a 100% test. But certainly, we're better than what's available out there. And, the beauty of the check-in is that it combines both the sort of traditional psychiatric measures with our objective measures. And so, you effectively get two different data points. And often, where you learn something is where these two differ as well.
And can you tell us a little bit more about how important mental health is right now in the current state of our world?
Oh, look, I mean, mental health is, the World Health Organization has basically come out about 18 months ago and, described, depression and mental health is the number one health factor in the world. You have a look at the statistics, that WHO report, the economic impact of mental health is around about $2.5 trillion annually, and they forecast that to grow to about $6 trillion annually in, I think it's around about 2020. I mean, another way to sort of, understand the impact is that, the direct medical costs for cancer in the US are around about $80 billion annually, and the direct medical costs related to depression, same direct medical costs are about $94 billion annually in the US. So, depression is basically a bigger problem than cancer.
And with regards to MediBio and mental health check-in, you guys have an app and a device for it, right?
Yes. So what we do is if you register at www.mentalhealthcheckin.com, you'll receive your little pack in the mail. That pack will be a heart rate monitor that you can keep, a little bit like the Polar heart rate monitor, although it's ECG quality monitor, and also instructions to go on and download our app from either the iTunes Store or Google Play. And, it's pretty self-explanatory. The guys or our technical team sort of describe me as the lowest common denominator at things technical in the company. And if I can make it work very simply, then I think, the average person certainly won't have any trouble. It's self-explanatory, runs you through exactly how to do. So yeah, you'll receive a pack in the mail, within a couple of weeks after registering.
And to anyone interested in knowing more about mental health and MediBio and mentalhealthcheckin.com, how can they get in contact with you, or how can they support the cause?
Look, if they want to support the cause, again, just register at mentalhealthcheckin.com. If they're interested in more information on MediBio or they want to contact the company, the easiest way is to go to our website, which is www.medibio.com.au. And there's a contact us there, so certainly happy for people to contact us as well. And look, if they want to find out more about mental health, probably the best place to start are websites like the Beyond Blue website or the Black Dog website. They'll provide a raft of data on mental health and the importance of it.
Again, that was Chris Knauer. He is the Executive Director of MediBio. MediBio is an ASX-listed company. Their aim is to make sure that people are in good mental health, especially those in the workforce. They've been doing research in the past 15 years and could have the very first FDA-approved diagnostic test for mental illness for depression. You can find them on www.medibio.com.au and at www.mentalhealthcheckin.com. Thank you for listening to us. If you want to listen to it again, or if you missed this interview, you can visit us on www.medibio.com hpr.fm or on www.healthprofessionalradio.com.au. You can also find our podcasts on iTunes and SoundCloud.